Abájọrò kì í pẹ́ kú, ohun àṣepọ̀ nílẹ̀ yẹ, ẹ̀yìn ọ̀la wa ti dára ọ́, àwa Èkìtì àti parapọ̀, ká parapọ̀ ká tún bá mú pọ̀, àwa Èkìtì àti gómìnira ọ̀kan làwa ń ṣe. Èkìtì Èkìtì tí gbòmìnira, Èkìtì Èkìtì tí gbòmìnira, àwa Èkìtì iwájú la ó máa lọ lágbára Ọlọ́run, àwa Èkìtì ọ̀kan ṣoṣo máa ní wá o láéláé.
Ekiti, I salute your resilience, cooperation, and collective resolve to keep Ekiti State free of this pandemic since the global challenge surfaced in Nigeria in February 2020. This is the 7th time that I would be addressing you since the breakout of COVID-19 pandemic in Ekiti State, in fulfillment of my promise to constantly update you on the progress we have made together and the new path that we must tread as we collectively fight this insidious but deadly disease. As my last address on May 31st, 2020, Ekiti State had tested over 150 people, contact traced about 200 people. I've had a total of 20 cases with 16 discharged, 2 deceased, and 2 active. We were also poised to acquire and activate our own mobile molecular testing laboratory, procured by the esteemed members of the Response Resource Mobilization Committee, under the leadership of Prince Julius Adeluyi Adelusi, with our iconic elder, Are Afe Babalola, and our past governors as patrons. The acquisition of a laboratory was for us a game changer in our strategy to combat the spread of the virus, as it will enable us to increase our testing capacity, especially to determine if we are already in the community spread stage of infection. Our laboratory has now been fully installed, accredited, and is functional, and we have increased testing in our communities. As of today, we have conducted additional 417 new tests and recorded 23 positive cases. In all, since we started combating COVID-19, Ekiti State has tested 567 persons and recorded 43 cases. Currently, we have 13 active cases, 2 deaths, while 28 patients have been successfully treated and discharged. Even though the 43 cases represent 6.7% of the total tests conducted so far, and even though it could be said to be relatively low, it gives me a great concern that we have recorded this much, and that in the month of June, many of the positive cases appear to have contracted the disease through community spread, as they could not be traced to any known cases. So, while our general risk assessment, in comparison to other states, is quite commendable, the implication of community spread is very grave and worrisome. Nonetheless, we have largely managed our situation better than most other places, and will continue to receive commendations for seriously enforcing our prevention protocols. We have also been very deliberate in our actions, especially in easing the lockdown, so as not to rush to take any action that could jeopardize the general health of our people, in spite of the tremendous pressure from some quarters who have been adversely affected by the continued closures that were imposed. While we quite understand the severity of their sacrifices, we had to balance every decision on the scale of public safety. In line with our phased relaxation of restriction strategy and to mitigate the losses in the economy of individuals and businesses. I announced the 5-day work week, Monday to Friday, but retained the restriction of movement at weekends, whilst night curfew and ban on interstate movement remained. I also directed the interface of government with stakeholders in the education, religious, and market communities to agree on modalities to reopen the sectors. I have now received the recommendations from the stakeholders and would like to thank all our religious leaders of the dominant faiths, unions of teachers and principals, private school owners, as well as the Parents and Teachers Association, representatives who served tirelessly on these committees to arrive at a consensus on how to return Ekiti to normalcy in a responsible, sustainable, and sensitive manner, whilst not compromising the gains of months of excruciating sacrifices by all of us. We have also tried to work in tandem with the national protocols on COVID-19 as coordinated by the Presidential Task Force and the leadership of the National Center for Disease Control to ensure that Ekiti State does not contradict the national containment regulations. By the current assessment of the situation and the advice of the experts, we have decided to proceed as follows. On restrictions, free unhindered movement will continue Mondays to Fridays only from 6 a.m. to 8 p.m. daily, while dusk to dawn curfew will be enforced 8 p.m. to 5:59 a.m. 7 days a week. There shall continue to be a restriction of movement at weekends, Saturday and Sunday, until July 19th, subject to the conditional relaxation of church attendance on Saturdays and Sundays. On interstate travel, in conformity with the federal government directive, the ban on travel to and from Ekiti State is hereby lifted, except during the dusk to dawn curfew daily. On large gatherings, the ban on large gathering of more than 20 persons, except on approved worship days, continues. Social, political, or business gatherings like parties, burials, meetings, bars, viewing centers, sports meet must not exceed 20 persons and must comply with prevention protocols of 6 feet social distancing, face masks, and hand washing. Government will be extremely strict in enforcing this ban, as shown in the recent shutdown of a church activity during a burial ceremony in Ekiti last week that violated the ban, and the officiating minister was arrested. On religious services, has jointly agreed with the leadership of the faith community, religious worship centers may resume controlled services from Friday, July the 17th, 2020, starting with worship services once a week, Friday Jumat for Muslims, and Saturday and Sunday services for Christians. This is, however, subject to very strict and full compliance with the regulations regarding worship centers, which includes social distancing of 6 feet between worshippers, hand washing, and face masks. Maximum capacity of each building should be determined with the 6 feet social distancing principle, and the number must be conspicuously displayed outside every religious building. A task force will go around to assess the level of compliance and issue a certificate of readiness before worship centers can reopen. Details of the regulations will be available on the state COVID-19 app and website www.covid19.ekitestate.gov.ng, as well as with the leadership of the faith community. Any worship center that violates the laid down protocols will be shut down and the cleric prosecuted. On schools, similarly, efforts are now in top gear to ensure our children return to school from July 20, 2020, as recommended by the interface between the Ministry of Education, Science and Technology and all the stakeholders in the education sector. However, this might be in phases, starting at first with students in terminal classes, SS3, GSS3, and Primary 6, to prepare for their examinations. Other classes will be gradually absorbed as schools meet all requirements to accommodate them safely and responsibly. A certificate of readiness showing that a school has adhered to all the conditions required for school reopening will be issued to all schools before they can reopen. On school sanitation, on the part of our government, apart from setting the general standard for both the private and public schools to reopen, we're embarking on a quick rejuvenation of our schools to ensure that basic facilities such as water, sanitizer, soap, and other facilities to aid hygienic practices are in place. I have also directed that all the schools should be fumigated and kept safe for our students before reopening. Our school reopening plans are without prejudice to the ongoing engagement at the national level. On markets, subject to compliance with the protocols on the operation of large markets, Ojaoba and Ojabisi in Ekiti will now be open to lock-up shops only. Face masks, social distancing, and hand washing will be strictly enforced in all markets in Ekiti State. Street trading, makeshift stalls, kiosks, and open display of wares in the market remains totally prohibited. Traders who do not have permanent shops in these markets are advised to move to our daily market, where more stalls have been prepared for use in the textile area. Market leaders should contact the necessary authorities on how to secure stalls for affected traders. Within our communities, now that we are in phased reopening of the economy, the risk of community spread is very high. Regrettably, it has been observed that many people are now living with a sense of false security by not adhering to the personal safety measures in public, such as the use of face masks when they're out, hand washing or hand sanitizers, and maintaining social distancing. This is the time to take personal responsibility for you and your family's safety and health, as contact tracing can no longer eliminate the risk of infection. To ensure our people know that this is serious business for us, I would like to further repeat that the use of face masks in public places will now be strictly enforced. I have directed the security agencies and the Ministry of Justice to arrest and prosecute any person caught in public places without wearing the face mask appropriately, covering the nose, the mouth, and the chin. The COVID-19 prevention regulation is still in force, and anyone caught in violation will be punished in line with the regulations. I was particularly disappointed with the unfortunate news that many of our people were holding funeral, wedding, and birthday parties in flagrant violation of public safety and in defiance to ban on such gathering. It has also been sadly observed that outside the state capital, Ekiti, people in other towns and villages do not take the preventive measures seriously. They hardly wear face masks nor observe any social or physical distancing, living as if they are invincible or have some immunity against the virus. Such deceptive self-confidence could be catastrophic and must stop in our own interest. Ekiti, following the successful establishment of our own mobile molecular laboratory and successful trials, we will begin our random community testing, starting with the Ekiti local government on July 1st, 2020, and moving from local government to local government according to a timetable that has already been drawn. The random tests will enable us to determine the level of community infection in our local governments. The health workers will also provide health checks for our vulnerable senior citizens to ensure any comorbidity like high blood pressure, cholesterol, or diabetes is well managed and under control. I therefore appeal to you all to cooperate with the medical team when they come to your home or community. As I stated in my last broadcast, there is nothing to be afraid of in taking the test as I have taken it myself. I appeal to our traditional, religious, and opinion leaders to help us mobilize our people by volunteering themselves for the test. Our battle against this pandemic has elevated healthcare on our list of priorities as a people and provided an opportunity to recalibrate our healthcare ecosystem. We have therefore been working to improve our health facilities, provide easier access for our citizens, and encourage our personnel to keep giving their best. Let me use this medium to express my appreciation once again to our health professionals who are in the front line of the fight against this pandemic. Some of them had contracted this virus in the course of duty. We thank God that those who got infected have now been fully treated and discharged. But this clearly explains the danger that our medical personnel are exposed to while working to keep us all safe. As part of incentives to boost their morale, I am happy to announce that the state has taken a 2.5 billion naira life insurance cover of 2 million naira each for 500 frontline medical personnel involved in the COVID-19 assignment. This is in addition to the prompt payment of COVID-19 special allowances to qualified cadres. Government is also working tirelessly to meet its obligations to the medical professionals as soon as possible. With the invaluable assistance of members of the COVID-19 Response Resource Mobilization Committee, we have begun the upgrading of our primary healthcare facilities, starting with the Primary Healthcare Center in Fayemi, Ekiti. The first stage will cover 9 facilities across some local governments, while our goal is to upgrade at least 1 primary healthcare facilities in all the 177 wards in Ekiti State. Government is also undertaking additional construction work in Ekiti State University Teaching Hospital and at the ByDr Infectious Disease Hospital. Additionally, government shall soon embark on the upgrading of all our secondary health facilities across the state. We are also expanding our medical facilities to be able to respond quickly to this pandemic. For example, another molecular laboratory is being planned for the state. This is apart from an additional one just secured by the Ekiti State University through TET Fund. Similarly, we're expanding our isolation centers from its current 150-bed capacity to about 500-bed capacity across the state. To improve our citizens' access to qualitative health care, I am pleased to announce the commencement of the Ekiti State Health Insurance Scheme on Wednesday, July 1st, 2020. Over 5,000 citizens have already been enrolled and will be able to access health care at all participating facilities from that date onwards. I will be happy to flag it off at a formal ceremony on July 10, 2020 in Ekiti. With our health insurance scheme now active, our people will not need to go bankrupt or seek unsafe modes of health care due to poverty. Affordable healthcare access is available to everyone who enrolls in Ekiti State. We have continued to provide succor for our vulnerable citizens in form of food palliatives with the support of well-meaning individuals and organizations like COVID, Victim Support Fund, and so many who continue to donate to our food bank. I'm also glad to announce that with the assistance of our Microfinance and Enterprise Development Agency, MEDA, hundreds of Ekiti citizens are accessing funds from the federal government COVID-19 support loans to reactivate their businesses after the shutdown. We are also working to attract more low-interest business loans from financial institutions to help our entrepreneurs revive and expand their vocations. I am aware many of our people are now avoiding hospitals for the treatment of ailments that are not associated with COVID-19 because of the fear that they might be held down or could be infected. This is an extremely dangerous thing to do. As you can see, we have had only 2 deaths in the state from COVID-19. Many people are, however, dying of other diseases because they do not want to go to the hospital for treatment. I therefore urge you to please patronize health professionals and not engage in self-medication that can be more deadly. Our hospitals are open and the healthcare givers are well protected to treat you. Ekiti, at this stage, the ball is now in our court. We must take adequate care, take personal responsibility, and ensure we keep safe. Every one of us must do whatever is within our power to ensure we jointly fight this dangerous virus to the end. No one needs to be persuaded again that the virus is real and here. We have seen many prominent personalities who could afford any medical care that money could buy succumb to the virus. That is why we cannot afford to be complacent or fatalistic about it. On a final note, I would like to thank you all for your trust, confidence in, and cooperation with our leadership, which has resulted in the low level of infection in the state. I thank our medical personnel, the security personnel, and all those who have been working tirelessly in the front line. I also want to appreciate our donors, members of the Response Resource Mobilization Committee, the Presidential Task Force, COVID, NCDC, and other organizations for their contributions. May we see the end of this challenge in good health. Thank you all, and stay safe. Alale Ekiti, Agbe Ekiti Rao.
Ohun abájọ́rò kì í pẹ́ kú, ohun àṣepọ̀ nílẹ̀yẹ, ẹ̀yìn ọ̀la wa ti dára ọ́, àwa Èkìtì àti parapọ̀, ká parapọ̀ ká tún bá mú pọ̀, àwa Èkìtì àti gómìnira ọ̀kan làwa ń ṣe. Èkìtì Èkìtì tí gbòmìnira, Èkìtì Èkìtì tí gbòmìnira, àwa Èkìtì iwájú la ó máa lọ lágbára Ọlọ́run, àwa Èkìtì ọ̀kan ṣoṣo mà ní wá o.